infertility is what we describe as an inability to achieve a pregnancy over a year. And we assume that you are having adequate intercourse. Adequate intercourse means you have sex 3 times a week. So if you're not having up to 3 times a week, we can't say you're infertile. But it affects both the man and the woman, averagely equal amounts. Like 40% of the time it's the woman, and 40% of the time it's the man. And another 10% of the time it's both of them, and 10% of the time it's, we don't know the reason. But for the woman, it's either related to a tube being blocked, the ability of her to produce the right kind of the numbers and the right quality of eggs, and the ability of the pregnancy to implant. So yes, so to achieve a pregnancy for a woman, we need good eggs, we need a good tube, and we need good lining. And if anything is wrong with any of the 3 of them, you're not going to get pregnant. For the man, he needs to have a certain number of sperm, and he needs to have a certain quality of those sperm. So the sperm should be the right number, should be able to, the right percentage of the sperm should be able to move forward and purposefully, and the sperm too should not have abnormalities. In other words, 2 heads or a bad tail or no tail or stuff of that sort. So those essentially are the major reasons why people have difficulty in getting pregnant, because one of these factors are faulty. For women, their major problems are related to ovulation. So we are for people who have got, if your diet is poor, you're at a higher risk of having problems that affect ovulation. If you're not able to metabolize, if there are problems with the glucose metabolism, for example, it may result in you not ovulating, and therefore you have difficulty in getting pregnant. The other lifestyle choices that you can make is if you continue having sex without protection, because then you can get a pelvic infection. The pelvic infection blocks the tubes, and then you cannot get pregnant. Men, of course, having sex without protection, same problem. The way she can acquire infection, the same way a man too can acquire infection. And that is why having sex with a barrier protection, we are referring to a condom, and reduces your risk of acquiring any of those infections that could affect your ability to get pregnant. For the man, the tube itself that carries the sperm from the testis out can get blocked, and then the sperm cannot come out. And then there are other infections too that can actually affect the man too. So even a simple thing as having a low vitamin D can cause you to have a difficulty in getting pregnant. So exercise, going about in the sun, ensuring that you are getting adequate amount of sunlight on your skin improves your chances. And first of all, they should be sure that their problem arose not from a medical reason and not from poor practices. We've said we want you to be having sex 3 times a week. The purpose of the 3 times a week is that by all means you shall be able to meet the ovulation time. You must remember that once the ovulation occurs, within 24 hours the egg is gone. So if you haven't had sex before that time or by that time, then the likelihood of the sperm meeting the egg is very small. If you have sex, we are assuming that you are ejaculating into the vagina. Because if you are ejaculating outside the vagina, the sperm is not going to meet the egg, you're not going to get pregnant. You understand? So all these are factors that they need to ensure that they have adequately covered. So if they are doing that and they are not getting pregnant, then we would suggest that we like to see them as soon as possible. For a couple that is fairly young, we say try for a year. If you don't succeed, see a health professional. And we would say see a health professional early. For a couple that is older, so if you're like, let's say above 35, or usually we say 40, I even like to bring it down to about 35. We'd say after 6 months, if you've been trying and not getting pregnant, see a health professional, because the chance, the window of treatment is smaller for those who are older, because age is one of our biggest enemies in getting pregnant. So don't think that it is, I'm waiting small, before you are aware, you've gotten to a worse situation. And that extends to where, and I like to say a word about those who are doing IVF. We tend to think that IVF, it's not your time. It's not your time. Your eggs depreciate with age. The quality and number depreciate with age. Sperm too, the same thing. not as fast and as hard as women, and not at the same age, but for women, 35 going, it becomes more challenging. And for the men, it's a bit significantly older before it becomes more challenging to sperm. But the idea is that if you need an IVF and you do it when you are young, under 30, your chance of getting a pregnancy is very high. That same woman doing it 10 years later is going to have the chances go down significantly, and after 40, the chances are pretty low. So taking an early and prompt action is really beneficial. But if you've tried, you're not getting pregnant, and you've spent 6 months to a year and you haven't succeeded, I would say seek for help. So there are couples who, one of the things I mentioned earlier, that's our biggest enemy for fertility is age. From the time you have puberty for women and even for men, you have the ability to produce a child. We try and encourage you to wait till about maybe 20 years or, but generally between 20 and 28, 30, your body is about the kind of easiest time you can have a child or you can get pregnant. For some people, owing to certain circumstances, they are not able to have a child within that window. Knowing that age is our biggest enemy, then we have to look at what are the things that we can do to ensure that we can still maintain our chances to have a child. Some of the things we mentioned earlier on, if you've got hormonal problems, get them fixed, get them addressed to ensure that you are able to, your system works the way it should be. If you've got, we've mentioned things about don't do make sure you don't get infections and things of that sort. Assuming that you go and get a pelvic infection, you get a pelvic abscess, you have to do surgery, you lose part of your ovary, your chances of getting pregnant has gone down. If you've got endometriosis, we have to be worried about, because endometriosis, for instance, is a progressive disease. The longer you wait, the worse it gets. The earlier you try and have children, the better. So people who have got endometriosis should be trying to have children as quickly and as soon as possible, because the disease destroys your ability over time to get pregnant. Then there is the almighty egg preservation, where if you look at your circumstances and recognize the fact that you are unlikely to get pregnant now due to whatever reason, you may choose that you want to freeze your eggs. So you would go to the hospital, we would do an assessment for you, we will give you, if you think it's a good enough reason, we will give you injections. The injections would help you produce plenty of eggs. We will remove those eggs from you and then put them in a freezer until the date and time when you are ready to have a child. So let's give you an example. Assuming you are 28 or 30 and you realize that your window, you want to have a child in the future, but you are not ready to have it right now. And you harvest your eggs and put them in the freezer. At 35, you come back and you say, hey, I'm now ready to have a child. Those eggs are still like a 28-year-old woman's eggs. So when they are fertilized and an IVF is done for you, your results, your outcome, your success rate is like a 28-year-old woman's womb, because the eggs are still pretty young. So of course you have to factor in the uterus too is there. The uterus is not 28 anymore, it's 35. And stuff like that. But you just, at least for the egg part, we know that you have a far better quality of eggs than if you were younger. And there are so many women who they're now at 42 want to have a child, and they could have tried and when they're 35 to say, in the light of the fact that this is not happening right now, I want to bank my eggs, and so your eggs are harvested and get frozen for you. So that option exists, and it's always sad when you are having a conversation and the lady says, I want to use my eggs, and we are like, the tests show that you don't have the eggs, or the quality of the eggs are really poor, and so it will not result in chances are really slim. And then she realized that I could have done this 5 years ago, and by now I would have been in a better place than where I am. PCOS means Polycystic Ovarian Syndrome. It's called a syndrome because it's more than just one factor that is inside. It's called Polycystic Ovarian Syndrome because when you do a scan, the patient has got multiple follicles in the ovary. So essentially what happens is that the client, or the woman, does not regularly release her eggs. So because she doesn't regularly release her eggs, the eggs are accumulated in the ovary, and that's why it gives you that picture. But it's essentially a hormonal problem. It's just a metabolic problem. We've discovered that it's actually a metabolic problem, and it's related to insulin metabolism or sugar metabolism. And it tends to happen to people who actually have got diabetic. They've got diabetic relatives, and those people tend to have it's more like a gene defect. You're not able to metabolize sugar very well. The insulin level rises, and it eventually manifests as what you call polycystic ovarian syndrome. But the clients tend not to ovulate, and because they don't ovulate and you don't release the egg, getting pregnant becomes a problem. They tend to have irregular menses as a result of that. If their insulin levels tend to go up quite a bit, they end up having excess amounts of male hormones, and so they have pimples, and then they have a lot of hair on their body and things of that sort. It is the major cause of infertility. When we're in school, they said it was something different. No, it is the major cause of infertility. But the PCOS condition can be reversed. There are treatments you can give that will ensure that you can kind of reverse its effects from the basis of its occurrence, not just trying to manage the symptoms. And once you're able to do that, then managing the outcomes become easier. But you manage the symptoms, correct the hormonal defects, then you can try and get them to ovulate, then you get pregnant. They also have a risk of losing pregnancy. They tend to lose pregnancies a lot. So you have to put interventions to try and prevent them from losing those pregnancies. Once you're successful in doing that, they get pregnant, they have their babies. And so you can successfully get them to 10. And we've successfully looked at quite a number of them. It's a difficult condition to treat. Sometimes, all the time you have to be blocking something. But the end result tends to be good if you have enough time to work on them and you're able to prepare them quite a bit before they get pregnant.